touch and high tech. In other words, combining, for instance, what we were hearing about the warmth of Indian healthcare staff and the warmth they give their patients with telemedicine and IT-enabled business processes. But certainly in Britain, that combination of high tech and high touch is really what modern health and indeed social care is about. But there were a number of other ands that I think came out very clearly through the discussion. One was high volume and low cost in order to achieve the scale that India needs, but frankly also to achieve the productivity gains that the United Kingdom needs. And alongside that, I would put high quality and lower cost, again, to meet the productivity as well as the scale challenge. And I think if we bear in mind those things where it's not a question of choosing between quality and cost, it's actually having both. It's not a question of choosing between scale and cost. We have to do scale, but we also have to get the unit costs down. And it's not a question of choosing between face-to-face warmth and electronic, digitally enabled services, whether that's actually the education of our healthcare professionals or the care of our patients. We need both all the way along the line. I think that will be very helpful. The other point I wanted to make is that just, again, listening to the discussion, I think we've already identified at a high level a number of potential areas of collaboration here. And a few that I would single out. One is around the new roles. And indeed, Savita, you mentioned a few more to add to the ones that came out earlier in the discussion. But patient educators, pharmacy assistants, life coaches, as well as the nursing assistants, the paramedics, and so on that we were talking about. All of those we've now got, I would say, in Britain, pretty well developed, not just professions, but training courses in all of those and many other areas, along with experience in the clinical governance and the regulation that you need to wrap around some of those roles. So I think there's work we could do together, sharing our expertise in the creation of new roles and then how you skill people for them. I think there's a lot of expertise from both countries that we ought to be sharing around how you create quite short courses. We were hearing about 5-day courses, 3-month courses, that sort of thing, but short courses that can themselves be modules and building blocks that will become part over time of higher and higher levels of qualification and upskilling, and that in turn leading to career progression for the individual health workers.